Did you know that colon cancer is one of the most preventable yet deadly cancers? But here's what most people aren't paying attention to: early warning signs often go unnoticed or ignored. Every year, millions of people are diagnosed with colon cancer, often leading to late-stage detection when treatment options are limited. According to the American Cancer Society, nearly 1 in 23 adults will develop colon cancer during their lifetime. What's even more important is that early detection can result in a 91% survival rate, yet thousands of cases slip through the cracks because the symptoms are mistaken for minor digestive issues. In the next few minutes, I'm going to share with you 7 early warning signs that could save your life. These are not the obvious symptoms you've likely heard about. They are the hidden red flags your body raises before the disease progresses. Most people overlook them completely, but recognizing them early can make all the difference. And let me be clear, this is not just another scare tactic or attempt to make you overly cautious. We'll be focusing on scientifically backed, evidence-based signs that have already helped countless individuals detect colon cancer early. Stay tuned, because this is not about creating fear. It is about empowering you with life-saving knowledge. By the end of this video, you'll have the tools to identify these early signs and take action before it's too late. Before we continue, please note that this content is for informational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Now let's dive in. 1. Persistent changes in bowel habits.
If a patient, however, does develop symptoms from colon cancer, one of the commonest symptoms would be a change in bowel habit towards diarrhea. So that means either passing more loose stools or more frequent stools.
One of the most overlooked signs of colon cancer is persistent changes in bowel habits. Unlike temporary changes caused by diet or mild gastrointestinal issues, colon cancer-related changes are consistent and progressive. You might experience diarrhea, constipation, or a narrowing of stool that lasts for more than a few weeks. These changes occur because tumors in the colon can obstruct or alter the normal passage of stool. Over time, the blockage worsens, leading to discomfort and a noticeable difference in bowel patterns. If left unchecked, this can progress to complete obstruction. A study published in the Annals found that 58% of colon cancer patients reported changes in bowel habits as an early symptom. If you notice changes in your bowel habits that don't resolve after adjusting your diet or hydration, it's crucial to consult a healthcare provider. Early intervention significantly improves outcomes, with studies showing a 91% 5-year survival rate for cases caught at an early stage. Ignoring these signs may delay diagnosis, potentially reducing treatment effectiveness. 2. Unexplained weight loss. Unexplained weight loss is another red flag for colon cancer that often gets dismissed. Unlike intentional weight loss through dieting or exercise, this symptom occurs without effort and can be rapid. Cancerous tumors require significant energy to grow and spread, diverting the body's resources and leading to unintended weight loss. Additionally, tumors in the digestive tract can interfere with nutrient absorption, compounding the effect. If you've lost more than 5% of your body weight within 6 months without trying, it's a sign that something might be wrong. Paired with other symptoms, this warrants immediate medical evaluation. Research published on JAMA Network in 2024 showed that nearly 60% of colon cancer patients experienced unexplained weight loss before diagnosis. Catching this symptom early often leads to better outcomes, as it prompts timely testing and intervention. Before we move on, if you are looking to dive deeper into the early indicators of cancer, be sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you reduce weight and feel your best delivered right to your inbox. 3. Blood in stool or rectal bleeding.
Bowel cancer has got predominantly the symptoms are rectal bleeding, either mixed with emotions or just only on the toilet paper. Now, this is especially true if it is persistent for several weeks
Blood in stool or rectal bleeding is one of the clearest but often ignored signs of colon cancer. Unlike minor bleeding from hemorrhoids, cancer-related bleeding tends to be persistent and can vary from bright red to dark, tar-like stool. Blood in the rectum or stool due to colon cancer occurs when a tumor damages nearby blood vessels in the lining of the colon or rectum. As the tumor grows, it can erode or irritate the delicate blood vessels in the intestinal walls, causing them to rupture and bleed. Visible blood is typically bright red if the tumor is located in the rectum or lower colon, as it hasn't traveled far enough through the digestive system to change color. In contrast, when the bleeding occurs higher in the colon, the blood may mix with stool, turning it dark or tar-like due to the partial digestion of blood as it moves through the intestines. In some cases, rectal bleeding may be mistakenly attributed to less serious conditions such as hemorrhoids, delaying proper diagnosis. Any instance of unexplained rectal bleeding should prompt a thorough medical evaluation to rule out colon cancer and other serious gastrointestinal disorders. If you notice blood in your stool or experience rectal bleeding, don't assume it's a benign condition. Immediate evaluation is essential, as early detection significantly improves treatment success. A study published in the Annals found that 89% of colon cancer patients reported visible or occult blood in stool as an early symptom. Ignoring this sign could delay diagnosis by months, leading to more advanced disease stages. 4. Abdominal pain or discomfort. One of the other frequently overlooked signs of colon cancer is persistent abdominal pain or discomfort. Unlike temporary bloating or cramps caused by digestion, cancer-related pain tends to be chronic and may worsen over time. This discomfort occurs when a tumor in the colon obstructs normal bowel movements or presses against surrounding organs. It may manifest as sharp, localized pain or a dull ache that's difficult to pinpoint. Sometimes, it can mimic symptoms of common conditions like irritable bowel syndrome, leading to delayed diagnosis. If you experience persistent abdominal pain that doesn't improve with lifestyle changes or over-the-counter treatments, it's essential to seek medical advice. Early detection could prevent complications such as complete bowel obstruction. A 2022 study in Annals of Oncology revealed that nearly 24% of early-stage colon cancer patients reported abdominal pain as a primary symptom. The study emphasized the importance of investigating persistent, unexplained pain to avoid misdiagnoses. 5. Fatigue and weakness. Unrelenting fatigue and weakness are minor but significant signs of colon cancer. Unlike normal tiredness that improves with rest, cancer-related fatigue is persistent and doesn't go away even after adequate sleep. This occurs because tumors can cause chronic blood loss, leading to anemia, a condition marked by a shortage of red blood cells. With fewer red blood cells to carry oxygen throughout the body, tissues and muscles receive less oxygen, resulting in reduced energy levels. This type of fatigue feels all-encompassing, affecting both physical and mental stamina. Simple tasks, such as climbing stairs or carrying groceries, may feel disproportionately challenging. Additionally, patients often report difficulty concentrating, reduced motivation, and a sense of heaviness in their limbs. Even after periods of rest, the fatigue persists, making it hard to resume normal activities. If you notice fatigue accompanied by other symptoms like shortness of breath or pale skin, consult a healthcare provider for blood tests. Early identification of anemia often leads to timely detection of underlying conditions like colon cancer. 6. A feeling of incomplete evacuation. A constant sensation of needing to empty your bowels, even after having a bowel movement, is another subtle warning sign of colon cancer. Known as tenesmus, this symptom often goes unnoticed or is attributed to minor digestive issues. This occurs when a tumor in the rectum or lower colon obstructs the passage of stool. As a tumor grows, it can partially block the intestinal passage, making it harder for stool to pass through completely. This obstruction creates a false sensation that the bowels have not been fully emptied, even after a bowel movement. Additionally, tumors can irritate the nerves and muscles in the rectal area, amplifying the sensation of needing to defecate. In some cases, inflammation caused by the tumor exacerbates the sensation by increasing rectal sensitivity. Over time, this symptom can worsen and lead to significant discomfort, often prompting medical evaluation. If you frequently experience this symptom, especially alongside other changes in bowel habits, it's crucial to consult a doctor. Ignoring tenesmus can delay diagnosis, allowing the cancer to progress to more advanced stages. 7. Iron deficiency anemia. Iron deficiency anemia, often detected during routine blood work, can be an early indicator of colon cancer. Unlike anemia caused by diet or heavy menstruation, this type results from chronic blood loss in the gastrointestinal tract. Colon cancer tumors can invade and erode the blood vessels in the walls of the colon. This leads to slow but continuous blood loss. Continuous bleeding reduces the number of red blood cells in circulation, a condition known as anemia. Red blood cells are essential for carrying oxygen throughout the body. To compensate for the loss of red blood cells, the body uses stored iron to produce more hemoglobin, a protein in red blood cells that carries oxygen. However, over time, the body's iron stores become depleted, leading to symptoms such as pale skin, dizziness, and shortness of breath. If you are diagnosed with unexplained iron deficiency anemia, especially if you're not menstruating or have a known dietary reason, it's essential to undergo further testing to identify the root cause.